All right, good afternoon, everybody. I'm really proud to be here with our senators, Blumenthal and Murphy. They were up late last night, and they're here to give us a briefing on the extraordinary work they did on the bill that's going to make a big difference for a lot of folks here in Connecticut and across the country. But for starters, just wanted to give you my daily update on what's going on here in Connecticut before kicking it over to them. And the information is sort of interesting. The number of folks infected actually went down a little bit, and testing went down a little bit. And the percentage of people who are infected went down a little bit. I don't think you can make very much from a one-day sample, by the way, but it is indicative of how these numbers are going to bounce around a bit, and I don't want you to jump to any conclusions too early. We have about 125 hospitalizations, 21 fatalities now. 19 of those people who sadly died are over the age of 70, and 15 of them are over the age of 80. That tells you a little bit about the demographic risk we have. I'd like to say something broadly also, because I've heard from a number of the folks running our hospitals that the testing will not be going up for the near term, and may slow up just a little bit, and our senators can talk about that. In part, what they're saying is, given the shortage of PPE, the protective equipment, and the masks, we need those nurses in the hospitals taking care of the critical care patients. And we can only have so many of them doing the testing necessary for you. So we're going to test those that are most critically in need. We're going to test those frontline responders we have to make sure are safe so they can be there to continue to take care of you. And again, those with the most severe conditions with a doctor's permission, we're still going to be able to do that. So in the meantime, I'm going to put much more of an emphasis upon a self-diagnosis and really urging each and every one of you to take your fever, see if you have any flu-like symptoms at all. If you have any symptoms at all, assume it's COVID-19 and go home and stay there for 14 days. If it's light flu or something else, it's really the same therapy. Go home, self-quarantine, and 99% get better, and those few that don't, call your doctor and we'll have you tested. I say that in terms of what I think about the workplace, because I've had a lot of questions about essential workers and the such. Let's say our factories. Our factories are open, and Sikorsky and Pratt. I'm really proud that increasingly they're trying to do a fever test for anybody that may be going into the factory floor, where there could be hundreds, if not thousands of people. And not just our major factories, but also a lot of the smaller factories that are part of the supply chain there. It is so important that you self-diagnose, and if there's any risk, any thought that you may have a flu-like symptom, go home and stay home. And I'd say more broadly, for anybody over the age of 60, go home and stay home. For folks over 60, here's my strong advice to you. Stay home. I urge you, don't go out for shopping or anything else. Unless you have to. If you have a trusted neighbor, you have a family member, have them go use one of our pickup restaurants, deliver some food to you, but stay home. And if you don't have that trusted neighbor or family friend who's there to provide that, we're working with Stop and Shop and a lot of our other amazing grocery stores to have them open at an earlier hour, like 7 to 8 in the morning, just for you, so that you can be there more safely. And that's incredibly important. We're getting the spaces lined up at these grocery stores so you're no more than 5 or 6 feet apart as you're waiting in the cashier's line. This social distancing is more important than ever, just as we see the crush of infections and people moving into our hospital beds coming up from the south further north. I'd like to say one other thing in terms of social gathering. You know, before we had said 50, but use your common sense. I'm going to be stricter than that. No more than 5 people in a social gathering, and less than that if you possibly can. When you're taking a walk outside, when you're seeing friends, stay apart and no more than 5. This is really important because even though young people are much less likely to have a severe condition from COVID, you're just as likely to pass it along either at home or to older folks. So I really want to be strict on that, no more than 5 people. Our store limits and the such are still going to be no more than 50 in those bigger stores. Everybody else, I'm really proud to see at our grocery stores, for example, people are waiting outside, separated by 6 feet, waiting to go in as necessary. Talking about self-diagnosis and self-quarantining, there's been a lot of questions about people who come in from out of state. And as said yesterday, a lot of our social distancing is already working. Ridership on Metro North is down 95%. You've seen the roads are almost empty in many cases. But I want to be really strict on this. If you don't have to travel to the state of Connecticut, say you're from New York City, a place that is a hot zone, it's better to stay home. It's better for you and better for the broader community. If you do think about coming to a state like this, I want you to A, self-diagnose in a serious way, and B, self-quarantine. Make sure you are 100% healthy after 14 days before you do a lot of circulation up here. It's a one way that both New York and Connecticut and our neighboring states working together can hold down the spread of this virus. In terms of social gatherings, we just got off the phone with the president and vice president, and again, he was talking about getting us back to business as usual sooner rather than later, which if you're a state right next to New York City, which is the epicenter of the COVID crisis, I think is bad advice. He says, jam the aisles at the pews on Easter. I'm really proud of, here in Hartford, where the Archbishop said, sadly, we're not going to be able to have church services on Easter. And I think you're seeing good common sense across the state when it comes to our churches and other gatherings like that. God helps those that helps themselves, and Connecticut is standing up and doing the right thing. It breaks my heart because everything I'm recommending is contrary to everything that I've always told my kids and I've tried to live by. Don't go visit Grandpa. Go teach him to FaceTime or drop food off at his front step. Don't go to work. Don't go to church. Skip church. But everything is different these days, except for the old axiom, you can't be too safe, or it's better safe than sorry. And I'm going to follow that maxim until we get through this crisis and we get through this crisis together. Look, I just want to say I'm incredibly proud to be here with Senators Blumenthal and Murphy. They were up all night last night. I'll tell you, it's a much better bill that came out of the Senate and a much better bill that we're going to have for the state of Connecticut, thanks to their good work. I really appreciate the $150 billion that is going to all the governors spread across, so we can target that money where it's absolutely necessary. I really appreciate what you're doing on unemployment compensation, because there we have a desperate need right now. But I'll tell you, we still have some work to do. I was talking to Commissioner Westby, and he said, we are a couple of weeks behind in processing all those unemployment claims. The number of claims that's come in is well over 100,000, and we're just scrambling to catch up. We have an old COBOL platform computer system, dates back 40 years. And so unfortunately it was scheduled to be fixed in 9 months, but that's not quite good enough. And don't think, guys, that we can link over to the system at a Department of Labor in Washington, D.C., because that crashed as well. But more importantly, I appreciate what you're doing, and I, as governor, each of us here in this building, the Capitol, are going to make sure that we can execute on the incredible good things you're doing for us and make sure they work for the people of Connecticut. So with that, I'd like to ask Dick Blumenthal,
Sure.
my friend, to say a few things.
Thank you. I'm proud to be here. Proud to be with Ned Lamont, who has been a national leader, really at the forefront of states filling the gap that the federal government has left and the president has failed to fill. I agree with the governor that the president's expectation that we're going to be back to normal by Easter is not only bad advice, it's worse than bad, it is abysmal, because the disease is going to set the timetable here, and we cannot have economic recovery unless we heal the public health emergency. The two must be accomplished together, and to belittle the health emergency is irresponsible and, in fact, unconscionable. Ned Lamont's leadership has been in dramatic contrast to what we've seen in the White House. What we've seen there is too little, too late. Testing was too little, still too late. Provision of equipment, like personal protective equipment, still lacking, chillingly so in many of our health centers. I've talked to health centers, advocates for domestic violence shelters, homeless housing, all kinds of nonprofits across the state, as well as small businesses. And what they have said to me is they need leadership in Washington, D.C., and it has been lacking and laggard all too often, in contrast to what we've seen from Governor Lamont. So I'm really pleased to be here today, and I think especially lacking at this particular moment, and Senator Murphy's been a leader. I've worked with him in calling for the President to use the Defense Production Act so we can produce some of that equipment. The biggest corporations and our labor unions are pleading with the President to produce more of this equipment by using the Defense Production Act, and repeatedly we've called on him to do it, but so far he has failed. This bill is a massive down payment, by far the biggest such relief package in the nation's history, $2 trillion, the size of the federal budget, and it was made better because we took it from McConnell and made it truly bipartisan, not just better, but bigger. And it provides for a medical surge, a Marshall Plan, that will help provide that equipment, the supplies, the masks, gowns, tests, the personal protective equipment that is needed in Connecticut and around the country, and that will help to fund the vaccines and treatment that the nation needs. And that Marshall Plan recognizes that we do have to address the healthcare emergency in order to successfully confront the economic crisis. But the basic goal here is to put as much money as possible, as quickly as possible, into the hands of workers, families, and small businesses. Very simple. And this bill accomplishes it through a one-time payment of $1,200. You're familiar with the details. I'm not going to go into them. But essentially, this money will go to them within the next 3 weeks, and it will be theirs to spend as they wish to cover the costs of their mortgages and rent and groceries, basic human needs. But we've also heard from small businesses who are struggling to survive, and loans going to them, $350 billion or more, can be used for rent, utilities, but also can be forgiven if they continue to employ their workforce, a powerful incentive to keep people at work. And if they're laid off, we have a vastly expanded unemployment insurance program, increasing by $600 the amount that goes to every person who is laid off or furloughed. Very important addition. People who are furloughed are eligible. And it is for 4 weeks, a tremendously significant extension. So the objective here is to put cash into the hands of those workers, of small businesses that are the backbone of our economy and who are struggling to keep their doors open and keep their folks on the payroll. And I have heard from them urgently, we all have, and we are heeding their pleas. Maybe most important for the reason that we're here today, a massive program of aid to states, $150 billion, tremendous discretion and flexibility in the way that governors can use it. It goes in some part to localities, but states have borne the brunt. And this provision, which was not even in the McConnell version of this bill, is a recognition that states have been at the forefront, bearing the burden financially and, in fact, leading. And the provision that provides for loan guarantees, a bailout of certain industries, has checks such as a bar on the stock buybacks and executive bonuses that we felt was a bad idea to allow them to do. But more importantly, it provides for transparency, full disclosure of these deals within a set period of time, not the 6 months that was originally proposed, and an oversight board and an inspector general with subpoena power. So those are some of the features of this bill, but let me be absolutely blunt. This bill is imperfect but imperative. It is not a panacea. It is not the final step. There needs to be a fourth and a fifth package to cover still the unmet needs. For example, emergency medical leave still fails to cover many workers. Family and medical leave still leaves many without recourse. Pensions and COBRA, extremely important. Consumer protections, a particularly grating omission for me, and I fought unsuccessfully for more consumer protection. Those kinds of measures are absolutely necessary in the bill that we eventually pass, plus more money for the medical surge, because hopefully we will discover new vaccines and new treatments, and people should not be required to pay the deductibles or other out-of-pocket costs to be covered by them. In short, I think what we need to do is keep our eye not only on the moment of crisis that we face right now. We need to immediately and aggressively respond to this crisis, but we also need to look ahead to what's going to be happening in 6 months, because there are now projections that this epidemic may resurface even if we conquer it in the next few months. It is going to be with us for a while, and certainly the economic consequences will be. So the kind of solutions that we provide have to be bigger and longer range, and I know that we are going to be working together as we have. I'm hoping that those stages and steps in the future, the new relief packages, fourth, fifth, maybe sixth, will be bipartisan. The first three were. And the unanimous vote last night, I hope, signals that our Republican colleagues sense the magnitude of this moment and the crisis that our nation faces. So with that, let me turn
Let me just say one thing. Thank you, Senator Blumenthal. You mentioned small business, and you mentioned this bill is better for the work that you and Chris put in. I had an opportunity to talk to Senator Murphy a lot about this. And early on, when it came to support for small business, they were talking about a payroll tax holiday or an income tax credit, which every small businessman knew was absolutely meaningless when your revenue has disappeared and there is no income. And one person who understood that really well was Senator Murphy, and he made sure the small business support stood up $350 billion, a forgivable loan if you keep people in place so that we have an economy that's ready to start up again. We're on the backside of this crisis.
One more point, if I may, Governor. The governor, as you know, has issued a request for a disaster declaration, and Senator Murphy and I have written, the whole delegation has written in support of it today. So we've been united as a delegation. We've picked parts of this package that were important to us, as we usually do, working on different aspects of it. and I'm happy to yield to my colleague.
Great. Thank you very much, Dick. Ned, thank you for allowing us to join you here today. Let me first thank the people of Connecticut. These are extraordinary times, and all across this state, ordinary citizens are stepping up and doing the right thing for their neighbor, offering to go pick up groceries so an elderly neighbor doesn't have to do it for themselves, offering to do a chore that someone who is quarantined cannot. And of course, making daily decisions to engage in self-distancing and following the governor's recommendations to stay home and to stay safe and to limit your interactions to small groups of no more than 5. This is a unique threat to the nation. It is a threat that government cannot defeat alone. It can only be met, it can only be conquered if ordinary, average citizens decide to step up and do the right thing day after day after day. Governor Lamont has been ahead of the curve from the very beginning. Senator Blumenthal is right. He has been a leader in Connecticut, but he has also been a national leader. He has modeled responses that other states are following, and we are very lucky to have him. As he mentioned, he and I think, talk every day, making sure that he knows what's coming from the federal government, but also to make sure that we are molding federal policy to meet what Connecticut needs. And I think that this package that we passed last night in the Senate will be effective in staving off catastrophe. But it is not the end of our work. I don't want to go over everything that Senator Blumenthal did already, but let me note that the Treasury is hoping to send out these cash payments to families within the next 3 weeks. This will be an important infusion of money, not just into individual families, but also into the economy writ large. Those unemployment benefits are not only extended for 4 additional months, recognizing that people are going to be unemployed for a longer period of time now than in previous recessions, but they are increased by $600 per week. That's a significant increase. The average unemployment benefit check in this country is somewhere just short of $400, so an additional $600 per week will make a big difference. And then lastly, we have molded this new unemployment insurance program to make sure that it takes care of as many self-employed workers and gig economy workers as we can. And so if you are self-employed and you are no longer receiving income, do not assume that you are not eligible for unemployment. Please call up the unemployment office, call our offices to see if you are newly eligible for unemployment insurance under the terms of this legislation. Let me thank the governor for his input on the small business assistance portion of this bill. It is true that he and I had early conversations about his desperate worry that businesses in Connecticut, small businesses, would go temporarily out of business, but then would never reopen. And it was his advocacy that led to this bill ending up in a place where it provides not loans that need to be repaid, but forgivable loans that do not need to be repaid if you hire your workers back, in addition to a small grant program of $10,000 that can be used right now for emergency spending outside of the loan program. A couple other pieces, just to mention, student loan payments, federally backed student loan payments are suspended for the period of this crisis. Really important for thousands of families that didn't know how they were going to make those payments over the course of the next few months. There's $30 billion in this bill for elementary and secondary education and higher education. Connecticut eats, sleeps, and breathes higher education. It's one of our strengths, and we were very worried that some of our colleges might not be able to survive. They will, now that they have this temporary funding. And schools, even though they're closed, are having to engage in all sorts of additional expenses to feed kids, to engage in distance learning, more funding coming for that. And finally, $100 billion for hospitals. Connecticut generally gets about 1 to 1.5% of all federal grants. So that means a sizable amount of money, in the neighborhood of $1 billion, coming to Connecticut's hospitals to make sure that we can engage in all of the additional services that we need to. And I'm going to be looking forward to working with the governor to make sure that that money lands where it needs to. And then finally, of course, the state stabilization money. Governor, I spoke a number of times yesterday as we were dotting the I's and crossing the T's on that state stabilization fund that will help Connecticut pay the bills and make sure that we can take care of folks. I agree with Senator Blumenthal, there's still a lot more work to do. In particular, we have an ongoing crisis of medical equipment in this country. The governor mentioned that testing is going to slow down, in part because we don't have enough personal protective equipment to go around to the folks that are working the med-surg units and the workers who are doing the testing. But we also are reaching our testing capacity limit in this country. And so the next most immediate job for the federal government, in conjunction with state governments, is to dramatically expand our capacity to make things that are necessary in order to meet the public health challenge. That, to my mind, means the federal government taking ownership of the manufacture and supply of critical medical equipment. It is beyond me as to why this president has not chosen to put into action the Defense Production Act, which would dramatically increase the manufacture of personal protective equipment and tests and ventilators. And it is also inexplicable as to why the president does not take control of the supply chain. The amount of time that states and hospitals have to spend rooting around for medical equipment and ventilators is barbaric. It is unnecessary, and it is wildly inefficient. We've got to do better at the federal level. Lastly, let me just thank all the frontline health workers. They are true heroes at this moment. Your job is first and foremost to keep yourself safe, but you are modeling behaviors for this state and this country that people are going to be grateful for years to come. Thank you, Governor, for inviting us here today.
Thank you, Chris. By the way, about that 1 or 1.5% we get based on population, we're close to the epicenter of the COVID crisis, so I hope they prioritize based on need as well.
Well, it should be basically there's a minimum of a certain amount of money, around $1 billion for every state, but then it should be according to need. And we're going to be fighting for more than Connecticut's fair share because we're bearing more than our fair share of the burden.
I'll tell you one other thing while there's a pause. We just got off the phone with the White House, and when it comes to competing for this material, you got 50 states all tripping over each other, driving up the price of things, and then you've got the federal government driving up the price even more, and the president jokes, well, then I won't bid on it. That'll bring the price back down 50%. So it really is the wrong way to go. The federal government should be taking the lead on this. We should be doing centralized purchasing and awarding the key stuff based on need. Any questions?
Tests are going to be declining. What is the criteria now for someone to get a test? Is it going to be based on age? Is it going to be based on symptoms?
Number one, which is what has always been, are those who are ill in the hospital. So we know who has to be quarantined and who doesn't. Secondly, it's going to be our frontline public safety workers and public health workers to make sure the nurses and doctors at the hospital and nursing homes are able to do what they've got to do. And finally, doctors are still going to be able to give you necessary permission to get that test as needed. But just remember, for almost all of you, especially those of you under the age of 50 or 60, it's a case of the flu, COVID or otherwise, just stay home for 2 weeks. It's the same remedy.
Did you say the number of positive cases in the state?
I did. I can't remember what I said, but I did say it. Give you 1 second. It was a little less than it was the day before, and the overall percentage of those infected was down a little bit as well.
And
It's up on the website, right? Senator Murphy.
About 1,025. So we went over 1,000 in terms of the total number of infections now. Thank you. Ask Paz.
Your DPH website right now. Senator Murphy, we all understand the frustration with what's going on with the supply chain and production. What in history, what in recent experience makes you think that it would be more efficient to have the federal government take control, in essence, under the Defense Production Act or any other authority?
I can't imagine anything being less efficient than what we have today. Today, every single hospital in every single state is creating their own supply chain, chasing rumors, chasing leads, trying to sort out the charlatans and con men from legitimate sourcers. Prices are going up, and the supply is ending up in places that don't need it. A privately run supply chain at a moment of critical need like this encourages both price gouging and hoarding. There are precedents for the federal government taking control of parts of the supply and distribution chain. During the during the early stages of the Ebola scare, the federal government did indeed take control of the supply chain for critical drugs and worked to pre-position drugs in places that they were most worried about cases being cited. Now, that was a very limited instance at a moment when we had less than 6 cases, but there are instances of the president using this power. And, well, I'm sure everyone has legitimate doubts about the efficiency of a government-run supply chain. What is occurring today is an absolute disaster. And you talk to almost any hospital or health center or provider in Connecticut, and they are begging for the federal government to make sense of a system today that is bankrupting providers and ending up with too many supplies in the hands of the wrong people.
But has this problem preceded the coronavirus crisis? And as you may recall, literally 10 years ago, I was calling attention to the lack of anesthetics, insulin, which has risen in price. This supply bottleneck, the exploitation of drug shortages, is endemic to this industry. It's one of the reasons why prices in this country of pharmaceutical drugs are so much higher than elsewhere in the world, because the Federal Trade Commission has failed to do its job in precluding price gouging, in effect. This problem has pre-existed this crisis, and many of us who called for stronger regulation, I recognize that the government taking over certain kinds of production, and it's not only equipment, it's drugs. Senator Murphy's talking about equipment, but the same kinds of bottleneck and the same kind of triage is performed by hospitals literally every day. If you talk to the head of Hartford Hospital, he will tell you how they are scrounging, one hospital trading with another because they lack the basic drugs that are needed, workhorse medicines.
Can I just follow up on that, just on the price? Sorry, go ahead. When you talked about the price, price controls, would invoking the Defense Production Act be a way to do that, or should the administration be acting on other authority to stop price gouging?
So listen, there's existing federal legislation that can be used to counteract price gouging. The Defense Production Act, though, allows the president to engage in a conversation and negotiation with manufacturers to require them to make certain goods at a fair price. The Defense Production Act would not be used to cheat manufacturers. It would be used to organize the manufacture and supply of critical equipment like masks and gowns and tests. And through the Defense Production Act, we could make sure that manufacturers are paid a rate that will incentivize them to make the equipment, but then make sure that that equipment ends up in the hands of areas of need. And this is really important for us in Connecticut. The governor talked about the worry that dollars from Washington will be spread out so thinly that they won't end up in areas of need. That's what's happening with PPE and tests today, is that they are going to the highest bidder, not necessarily to the places of greatest need. And only the federal government can step in and correct for that. And the DPA allows you to take control of the manufacturing. other authorities, emergency authorities that the president possesses under the declaration of emergency allows him to control the supply chain.
And if you look ahead, I think this point is really fundamental, because if you look ahead, hopefully we're going to have vaccines. We're going to have treatments. They are developed with taxpayer money. There is absolutely no reason that private companies should have hefty, even exorbitant profits, having developed new drugs. We're not talking about equipment, but new drugs through research and development that's financed with our money. And the government ought to be using existing law. We don't need new laws necessarily for a lot of what ails the pharmaceutical drug economy. It's existing law that's unenforced and existing rights that the government fails to take advantage of.
Hey, Paz, can I just give one other example? I, as the governor of Connecticut, could go to General Motors and say, I will pay you up front for 50,000 ventilators right now. Or the federal government could go to General Motors and say, I will pay you up front for 5 million ventilators, and that we would get them twice as fast at half the price if the federal government took the lead. Sorry.
You mentioned the people, Metro North ridership down 95%, et cetera, et cetera. What is your viewpoint on Gina Raimondo in Rhode Island basically saying an executive order, if people come in from New York, they have to self-quarantine for 14 days if they're coming into Rhode Island? What is your view on Raimondo and cross-border crossing?
Well, I was chatting with her about that. Look, I think it makes sense. As I said, for the folks coming up from New York, my advice is stay close to home rather than traveling a lot during this day and age. But if you are coming up, test yourself, self-diagnose, and self-quarantine for 14 days. It makes good sense. If at the end of a few days you've tested, you don't have fever, you can get around, that's okay, that's different. But let's face it, it's this global economy and fast transportation that's transmitting this disease at warp speed. So it makes some sense for people to be more self-contained and self-quarantining.
Governor Cuomo is limiting certain construction services, and Governor Baker is lifting the tax on plastic bags. Are you considering either of those things?
Lifting the tax on plastic bags, yes. I didn't catch the one on the construction services.
He's limiting some of the construction
Here's
that he's
my
allowed
feeling on
under
construction. Big outdoor construction projects, the Charter Oak Bridge, those schools that you need on time. Practice good social distancing. Test yourself before you go to work every day, because you're probably working as part of a construction crew. Let's keep going. I think that's part of our economy, and I think we can do it safely. If the governor was talking about, small inside construction, there we ought to be a lot more strict. Sorry.
On the plastic bags, several New England states are now lifting that ban. Are you saying you're going to lift the ban? They're actually banning reusable bags.
Remember, I never had a ban. What I did do is put a 10-cent tax, and we're going to lift that 10-cent tax. It's contrary to every environmental instinct I've got in my core, but I think for now, I want to make sure the folks working at A&P feel safe, and I want to make sure that it's the public health right thing to do right now.
Massachusetts had banned reusable bags and require stores to give paper or plastic for free during this time?
I'd sure recommend they do that in terms of the paper bags, but let me figure out about bans.
Residents coming up to Connecticut, there's a lot of concern. They're supposed to be sheltering in place and quarantining at home in New York, and now they're not listening to that, so they're coming up to Connecticut. Are they going to listen? And if you see a family of 5 move in with another family of 5, that is a little bit of concern. Is there anything you can do about that, or is it just...
Yeah, don't move in with another family of 5. That you're doubling the risk for your family as well as their family. Do you want me to write a law that says no moving in with families of 5?
It's very frustrating because it's happening. We have people with pictures sending us of New York plates on their driveways, and they're very concerned because they know it's the hot zone. So I don't know what you can do. But
what I am doing is what the other governors are doing, saying if you are going to come up here, maybe you have a house, maybe it's your right to go visit your house. Test yourself on a regular basis. You are coming from a hot zone, New York City. You're much more likely to be infected there by a factor of 10 compared to Litchfield County. And if you come up, be respectful. Stay inside, self-quarantine until you know you're safe.
Governor, Rhode Island's governor has just ordered that she's going to be ordering state troopers in Rhode Island to pull over cars with New York license plates. Are we talking about that at all here in the state of Connecticut?
I'm not talking about that at this point. But as I pointed out to you, the roads are pretty much empty. The railroads are pretty much empty. A lot of people are doing the right thing. And if they're not doing the right thing, I'm going to step up and be more forceful.
Another question here. You mentioned earlier this week about a charitable initiative called 4CT. We didn't hear much more about that. Any more information about who that'll be benefiting here in the state?
Sort of events got in the way. I'm going to roll that out formally. We are raising money from incredibly generous individuals across the state, helping out our not-for-profits and others as they try and help you out.
Would you consider making grocery store workers first responders so that they could get access to priority testing and also access to child care?
Look, the child care, yes. I'm not in the position to give away priority testing right now since we're sort of strapped on that, and I'm putting frontline healthcare workers at the top of that list.
Is the state getting enough information from the nursing homes and the other assisted living communities about who is testing positive there, the staff and the patients? In other words, I'm referring to the problems in Ridgefield, et cetera. Does the state have a handle on, for lack of a better term, hot spots at certain nursing homes?
We do, Chris. The nursing homes know that they have a population that's most at risk. They know it's a petri dish for spreading that virus around. They're being incredibly careful. That said, there are some risks of contagion there, and we're following that very carefully, testing as necessary, moving people to separate quarters so we can make sure that the rest of the nursing home is safe.
What do you say to people who are watching Fox News or OAN and seeing the message that, yes, we have a crisis, but we're overreacting. We can go back to work in 10 days. 20 people in their 20s and some other healthy people who are younger can go back to work. People who have had the disease already and it's run its course can go back to work. And that
I'll try that.
The 6-foot distancing is working.
I'd really
what do you say to those people?
I say this, at the end of the day, you can accuse me of overreacting, but you're not going to accuse me of underreacting. I really think right now safety is going to be absolutely paramount to what we've got to do. And I'm going to do everything I can to make sure that less people get infected and that our hospitals have a little more capacity and a little more time to take care of everybody else. But Dan, I am thinking about the day after. You know what we're doing on education. You know what our senators have done to make sure our small businesses have an opportunity to stay intact so they can hit the ground running on the backside of this. But in the meantime, let's solve this public health crisis first.
I mean, there are only two choices here. One choice is a temporary, very painful recession caused by social distancing that we can manage through stimulus and smart policy. The other choice is to give up and to have an economic meltdown because millions of Americans die and our healthcare system collapses under the weight. There is no in-between. The president would like you to think that we can set an expiration date on the virus. That's not how this works. There is no country that has turned the corner on COVID-19 by giving up on emergency authority and social distancing. And so we just have to understand that we've got a choice to make. And thus far, thanks to Governor Lamont and others leading like him, we've made the right choice.
And let me just point out, I realize I have sounded like a broken record on testing. The Surgeon General was here. When was he here?
A couple weeks ago.
Several weeks ago. And I said to him, and I said to you, the lack of testing is the fundamental flaw. You cannot go back to normal without testing people. You can't let kids go back to school. You can't let people go back to the workplace. You can't let the state employees go back to their work without widespread testing. You don't know the trajectory of the disease, and you don't know how to trace and track and stop it. And that's why this failure to test is leading to the false sense of security that we have. And these, we can learn from history here, not just recent history, but the Spanish flu experience of 1918, which killed 35,000 troops before they even got on a boat to go to Europe in the middle of the war. We know that the disease sets the timetable. It's like as the military says, the enemy has a vote. The disease here has at least one vote, and it will not follow the magical thinking and the happy talk of an administration that understandably wants us to go back to work. All of us want the nation to go back to work, but ultimately the costs are horrifying, not just economically, but in loss of life, literally. And we're going to see the hospital systems of this country deluged and overwhelmed. Absolutely horrendous.
Clearly, Easter is uninformed, wishful thinking. What is the latest federal guidance from actual experts on how long this could last?
You cannot put an artificial timeline on this virus. I understand that people want to know when they can go back to work. Families want to know when their schools can open back up. But our job right now is to keep our head down, to keep plowing ahead with smart personal practices and smart government policies. And what we know by watching other countries is that it does not take a year. It doesn't need to take 6 months. If we all are in this together, then we can turn the corner in a matter of months, not a matter of years. But again, that's a collective decision that we all make together. Smart government policy, but also millions of decisions made by individuals who self-test, who choose to quarantine, who make smart decisions. And if we all make good decisions together, then this doesn't have to last for 6 to 12 months. But for now, unfortunately, the answer is to just keep your head down, do the right thing, and trust that if we do so, the end can be in sight.
Here's my message to the president. Listen to the scientists. Listen to the public health experts. Listen to the doctors. Listen to the people who know. And they're all telling him, we don't think so. And Dr. Fauci says, if you think you're overreacting, you're doing the right thing. So and plus which, as has been said repeatedly, the president can't dictate what the governor of Connecticut does anyway. Ned Lamont is going to do the smart and right thing, regardless of what the president says, and so will Republican governors as well as Democratic governors.
We've got two shoreline communities, Old Lyme and East Lyme, where leaders are now saying they want New Yorkers and people that come from hotspots to self-quarantine there. They say they're looking for direction from you because that goes further than any mandate that you've already ordered. Have you talked to the leaders of these communities, and would you entertain the idea?
I talked to them right now. I said, people coming into the state, A, self-test, self-diagnose, and self-quarantine. I could not be more clear about that.
Mandate that through an executive
Mandate
order.
that you take your own temperature? All
No,
right,
that
I
people-
mandate. Take your temperature if you come to the state of Connecticut.
That people quarantine. I mean, they said that they're looking for more direction from you. They can't enforce it without a statewide mandate.
I cannot be more clear. If you come into this state, I want you to, A, self-test, self-diagnose, and until you know that you're healthy, until you know you're not contagious, I want you to self-quarantine. I'm ordering you to self-quarantine. How's that? Can I? Yeah, go ahead.
You're lowering the limit for social gatherings to 5. Is that going to be in an executive order, or is this just guidance? And the second part is, what prompted you to do that? What have you heard? What have you been advised to make you make that change?
He and I took a walk through a state park on Sunday afternoon, and I saw a lot of folks, mainly young folks, walking in clumps and not taking social distancing very seriously. And I took to heart that, look, I can order anything I want with executive order. It's really up to you and your neighbors to go speak to these people and say, what you're doing is unsafe. But as you point out, if I put this into an executive order, make that clear, it's even better. But Paz, as you know, I can meet with one group of 50 or 10 groups of 5. I've still met the same number of people. Fundamentally, it's going to require real common sense to make sure you limit the number of social interactions you have for the near term, for the foreseeable future.
It was announced this morning that a company like the Cheesecake Factory, says that they're not going to be able to pay their rent for the month of April. They made $2.5 billion last year alone in revenue, and they can't even pay their rent for the month of April. New York State is urging a 90-day grace period for mortgage payments for residents of New York. If someone works at the Cheesecake Factory as a waitress or a waiter and makes minimum wage, they're probably having a tough time paying their rent or mortgage. Any guidance or conversation here in the state
we
about
have
that?
talked to the banking community here in this state very explicitly. I think they've put out a strong guidance that they are going to forbear in terms of interest and principal payments, and I think that's an important thing to do. You know, we as a state, when it comes to our loans that we have extended through economic and community development, we say no interest or principal payments due for the next 90 days. And our senators have put forward a bill that really helps small business for the near term.
Just a second question. You were talking about executive orders here, and like yesterday, you told me to keep asking this question, so I'll ask it again about ordering these insurance companies to mandate a 60-day grace period for extended deferred premium payments. Any more thought on that? Will you be doing it?
I talked to one of the insurance presidents today, and I said, I'm going to get asked about it again today, and I think it's the right thing to do, and I'm fighting for each and every one of the working families and small businesses here in this state. And they are at great risk if there's a sense that you're going to discontinue or end their insurance. And don't tell me about COBRA. I love COBRA, Dick, but it's also really expensive unless we get some subsidies to make that possible.
We need reforms. That's the reason we need reform.
With the high unemployment, Senator Blumenthal, with the high unemployment, did you have any concerns on the, lack of a better term, Lindsey Graham provision? He was concerned about people getting more than 100% on their unemployment insurance when they get it back. The vote, I believe, was 48-48. He was concerned that people could get more when they were unemployed than when they were working.
You know, I think that amendment was mean-spirited and cruel. And ironically, I agree with the Secretary of the Treasury, who was asked about it at the briefing yesterday, and he said people want to work. Yeah. People want to work. They don't want to sit home if they make $50 more in unemployment insurance than they would when they're on the job. They had the job. They loved doing it. They wanted to feel productive. And what's more, by the way, the cost of administering a system that tried to cap unemployment insurance at less than the $600 addition would be horrendous, and it would cause delays. So the point is, get this money into people's hands and pockets so they can put groceries on the table, pay their mortgage, their utilities, their rent, and the small business provision is crafted to enable small businesses actually to benefit if they keep those people on their payroll. So we don't want people to be going on unemployment insurance. We want them to continue working, and that's what they want to do.
Let me just mention on the
that you guys are doing.
Just for a second, just on the question of restaurants, because restaurants have been amongst the hardest hit and earliest hit, there is a provision in this legislation that would allow for restaurants of above 500 employees to be able to qualify for some of the small business assistance.
Senators, is there anything that you guys are doing to help Connecticut residents get back to the state of Connecticut who are stranded in Peru and other places of the world?
Secretary Pompeo, we did a letter together. There are still people stranded in probably more than 25 countries. We have worked, I personally, for example, spent a good deal of time talking to the Peruvian ambassador. And we have pressured the State Department to send charter planes. In Peru, for example, only 3 airlines were flying, and they ceased operations. We've worked hard to try to get them to resume, and we've been very successful, actually. The State Department is working a little bit harder, but I'm disappointed that Secretary Pompeo hasn't taken a more active role, but we have worked together on individual cases. This is part of what we do. We help individual families and cases. These people were stranded in these other countries because of the policies of those governments that in effect closed their borders. So we ought to take a lesson here. Closing borders can be a pretty burdensome and unwise thing to do, and shutting down the ability and access of airlines is burdensome not only to the people who live there, but to countries like the United States.
The biggest problem for Connecticut residents right now is Peru. We have, starting today, flights out of Cusco, which was a location in the mountains where many Connecticut residents were stranded, and multiple flights out of Lima, I believe, starting yesterday. And so you will see this week and into the weekend the movement of Connecticut citizens out of Peru start happening much faster. And I think both of us were on the phone yesterday with the State Department helping to work that out.
I just want to go back to that issue of the health insurance. We've gotten so many emails about this one topic just because it really arguably affects more people than...
I'm talking to Bob Clark, our general counsel. I'll see what authority I have under my EO. Right now, I am urging the health insurance folks, take care of these people in this time of need. Utilities are doing that. The state's doing that. Telecom companies are doing that. Landlords, I hope, are doing that. Banks are doing that. We're all going to step up and make it easier for people to get through the next, how long it is.
Governor, any thought about the homeless shelters? I don't know that we've seen a lot of cases, some, but it seems to be a potential area of transmission, and
It is a potential area of transmission. We are opening up, talk to Celia over in housing. We got 2 or 3 locations spread across different cities. So those homeless, A, we're getting them a place to stay, and B, if they're being tested or we find they may be carriers, we have them in a quarantined area.
The senators and governors, are you worried about mixed messaging? Because what you're saying about social distancing, staying the course, could widely differ with what the president's going to say in about an hour when he goes live. When you've pushed back on him during the private conversations that you've had, has he been receptive to what you're saying?
I don't think so. I mean, I think, look, in his heart he says, I want to do everything I can to get this economy going again, but I think the senators are right. You're never going to get this economy going again until we get this public health crisis behind us. And so I think it's wrong to say we can rush people back to work and set artificial dates like he did.
I think the people of Connecticut should listen to the recommendations made by Governor Lamont. Listen to your governor.
What are the chances that the federal government will treat Connecticut and the New York region as an area of concern and give them more federal funding?
Good questions.
So the state stabilization funds are allocated by population, and there's a reason for that. States in the middle part of the country don't necessarily have as low a rate of infection as you think. Part of the issue is that they haven't begun to test. And so the concept is that every state 2 months from now may need significant funding. The other funds in the bill, like the hospital funds, the funds for higher education, we're going to fight to make sure that those are need-based to the extent possible under the law. So there's a lot of money in this bill. By virtue of the way in which money flows to people who are unemployed and small businesses that have shuttered, those funds will tend to go to states that have high need, states that have put in place orders that shutter businesses. The state stabilization funds flow simply based on population. Other funds we will fight to make sure that they end up in the hands of states that have higher need.
But again, there's going to be, we're going to be here in 3 months. And we're going to look back and say, we thought we really solved this problem. And there's no way that we have. If you look at the projections about where this disease is going, and just, you don't have to look ahead 6 years, but just 6 months, the costs are going to be humongous. And so we're going to need another relief package. Nancy Pelosi is talking about it today. And I hope it will be bipartisan, because we're at a transcendent moment for our democracy. It's really a question of whether we can make this system work to meet a public health crisis in this country that will flatten our country economically if we fail to do it. People are not going to want to go to restaurants or malls or barber shops or baseball stadiums if this virus continues to grip the nation. So talking about just snapping the lights on and having people resume a normal life just is totally unrealistic.
We got an email from one of our viewers. She made just over the $75,000 mark with this federal aid package to get that $1,200 check last year. She worked part-time as a teacher. She worked part-time as a waitress. Both of her sources of income are now shut down. Connecticut's not exactly a cheap state to live in. What's your message to her? She's not going to be getting any aid because she just made just over that arbitrary number of $75,000.
No doubt that whenever you're writing legislation like this, the number you pick is going to be arbitrary, and there are going to be people that fall on the other side. The amount of money actually phases out over time, so you get the full grant up to $75,000, but you get a reduced grant if you're making between $75,000 and $100,000. So she'll be getting something. But again, if she is in a position where she has lost all her income, she is going to be eligible for a supersized unemployment compensation check that will last for 4 additional months beyond the traditional period. And so, listen, nobody wants to be unemployed. Nobody wants to be collecting an unemployment check. But this legislation understands that the traditional unemployment benefit was just not going to be enough to keep a lot of families whole, especially in a high-cost state like Connecticut. And that will be, I think, a lifeboat, the additional $600 per week in unemployment benefits to a lot of families in Connecticut.
Hey, let me just...
I think the better question really is, will $1,200 really make a difference? How much of a difference will it make? For a lot of people in Connecticut, it's a month's rent. So that's why we need to think big. We need to think bigger and better, because for Connecticut and for many other states, this $1,200 payment looks a lot better than it really is. And Chris is absolutely right. Unemployment compensation, small business, putting people back to work rather than just shoveling cash is really the longer-term solution.
Let me just say in conclusion, look, this pandemic is probably worse than we had anticipated, and it's going to get a little worse before it gets better here. I'm so proud of the people of the state of Connecticut, the healthcare, the hospitals, the overtime, the nurses, the doctors, the heroes, working with our first selectmen, working with our mayors, people stepping up, the social distancing. Maybe people didn't take it quite as seriously early on. They're taking it seriously now. You know, business and labor are stepping up, but I could not do it without, you know, Chris and Dick and the federal government. And we're in this together, and this is how we power through this. Ronald Reagan once said, and I thought it was pretty funny at the time, that the 9 scariest words in the English language is, "I'm from the federal government and I'm here to help you." And we chuckled, but right now we really need you here. And what you did at 2 o'clock in the morning or whatever it is making a difference. And I appreciate you staying in close contact with us, making sure we get the money going where it ought to be. Look, it's a tough situation for each and every one of your families. Everybody's cramped in. You're at home. I know the anxiety there's. Their job is not there. The business is not there. But we are going to get through on the backside of this by working together. And with that, I got to thank Chris and Dick. Thank you so much for everything you guys are doing. And I like this a lot more than the Armory. Thanks, everybody.
Thank you, Governor.